There's only one way to press the button, Brady.
So
It was not working earlier.
If you press the button and stopped it, where would it save at?
It's going to save on that jump drive.
Did you
Okay.
stop it?
No.
Stop
Well,
it. And then we'll try it again.
just go now.
Oh god.
So I'm going to edit it anyway, so I'll just chop this part out. So just when you start, I'll chop it up.
Cool.
Open it.
Oh, I didn't know it was locked. I think when you press the button, press it down. I think it's a dial, so you can turn as well. And I think I don't know if y'all were pressing and turning at all, but I think just press down.
We got that, yeah? Cool. Group 1, Alzheimer's disease. My name is Caitlin. We have Andrew, Brady, Bianca, and Morgan in the group as well. So Alzheimer's disease is a form of dementia. It makes up 60 to 80% of all forms of dementia. It's very common. A brain disorder, it's a brain disorder that damages and eventually destroys brain cells. It causes memory loss and changes in thinking. It slowly develops over time and gradually increases, and there's no current cure, so it gets worse over time and sometimes leads to fatality, but not in every case. The early signs of Alzheimer's are poor memory. You do things like you repeat questions and get lost going places you're familiar. So you might repeat a question like, where are my keys? And then you find your keys and then ask again, where are my keys? And also getting lost as far as going home or to the grocery store that you're familiar going to. Advanced signs of Alzheimer's are forgetting how to do simple things like brushing your teeth or getting dressed on a daily basis. You get confused about the time and place. You also forget names and wander from home. So the forgetting names are their names that you should remember, like your sister's name or your mom's name, and wandering from home. Physical changes to the brain. The cortex shrivels up, and the cortex is involved with thinking, planning, and remembering. There's severe shrinkage of the hippocampus, which is involved in creating new memories, which makes it more difficult to do that when it shrinks. And your ventricles become larger, which are just the fluid-filled parts of your brain. So here you can see that the hippocampus has shrunk. The ventricle right here is much larger than in the healthy brain on the left, and the entire cortex has shrunk significantly compared to the healthy brain. Damage to the brain cells. So on the left, there are the damaged brain cells with the individual who has Alzheimer's, and here are healthy brain cells. There are fewer nerve cells and synapses in a brain suffering from Alzheimer's, so you can see the connection between nerves is a lot less than in the healthy cells. There's a buildup of plaques between nerve cells, so you can see a buildup here. And then dead and dying nerve cells contain tangles. So this nerve cell right here at the front just shows that it's kind of dying off and the connections aren't as good in between those cells. The cause of Alzheimer's is unclear, but tangles and plaques are believed to play a big role. Exercise is believed to lower the risk of Alzheimer's due to an increased blood flow to the brain and increased oxygen to the brain. Exercise also lowers things like blood pressure, your risk for cardiovascular disease, and your risk for stroke, which those can all lead to Alzheimer's disease, so preventing those and the risk of those can help in the long run. There was a study conducted for 1 year in 65-year-old individuals where they were required to work out 40 minutes, 4 times a week, and it actually improved the connectivity in part of the brain that's involved in memories and daydreaming, so it just proves that or supports the theory that exercise helps keep your brain function proper and the connectivity strong. So more studies have been completed supporting the theory of exercise as medicine for Alzheimer's disease, and Bianca is going to tell you about one right now.
Okay, so my research article is called Benefits of Multimodal Exercise Intervention for Postural Control and Frontal Cognitive Functions in Individuals with Alzheimer's Disease. So basically, the objective of this research study was to verify the effects of a systemized multimodal exercise in individuals who have Alzheimer's to help see if it improves their cognitive function, their postural control, and their functional capacity overall. The design was a non-randomized controlled trial with 30 older individuals of which 14 were assigned to the training groups and 16 were assigned to the control group. So introduction, basically just wanted, well, as Caitlin mentioned, in Alzheimer's disease, frontal cognitive changes can occur as in the early stages of Alzheimer's, and it's mainly due to atrophy in the frontal cortical regions, and studies have found that individuals with early stage Alzheimer's may also have a discrete motor abnormalities. One way of investigating these motor abnormalities in individuals with Alzheimer's is to determine postural control oscillations on a forced platform during dual task situations what this study conducts. So this has hypothesized that physical exercise associated with frontal cognitive stimulation would improve frontal cognitive and postural control in individuals with Alzheimer's. So the interventions included in this research study, frontal cognitive function was evaluated using several different tests, including the Montreux Cognitive Assessment, the Clock Drawing Test, the Frontal Assessment Battery, as well as a Symbol Search subtest as well. This intervention was designed with the goal of improving the components of functional capacity and frontal cognitive functions. And the protocol encompassed to assess these cognitive components includes executive function, attention, language, and included a comprehensive approach that aimed to stimulate the components of functional capacity while also stimulating the frontal cognitive function as well. So this right here is just a little graph included in the research article, showing how the intervention process worked. So the intervention was a total of 16 weeks altogether. At the very beginning, they would have the individuals stand on a platform just to see that they can control their balance. And then after that 4-week period, they would then increase the motor and cognitive overload. For example, so they would also stand on a platform, hold an object in their hand, and count to 30. And then once they progressed to 8 weeks, they would stand on that platform, hold an object in their hand, count to 30, and also look at a certain target, and so on and so forth as 12 weeks came up and 16 weeks came up. So all of these interventions were performed during a 60-minute session and was divided as follows. The sessions included a weight training, agility, and flexibility, and balance training as well, and all to stimulate attention, language, and executive functions as well. So the participants were subjected to motor and cognitive overload so that they did not adapt to stimuli, which I explained in that previous chart of the intervention program. And the aerobic capacity of this study was maintained between 65 and 75% of their maximum heart rate. As far as the results for frontal cognitive functions, overall the intervention group did improve better than the control group, and they had a higher scores than the control group as well. Just overall performed better than the control group. As far as postural control, the intervention group did show some reduction at the end of the program. However, they did show significantly less body sway compared to the control group. And then for functional capacity, just again, overall in general, the intervention group did perform better on a dynamic balance spectrum, and the intervention group also achieved greater gains, mainly in the lower limb strength and also greater flexibility than the control group. So overall, this research study, after the 4-month exercise period, the stimulation of the intervention program, the individuals performed better on dual task activities than the control groups, and found that functional capacity improvements, especially in lower limb, muscle strength, gait, and flexibility and balance were seen. And so overall, this research study did confirm the hypothesis, which is that physical exercise associated with frontal cognitive stimulation enhances frontal cognitive and balance in individuals with Alzheimer's disease. So now I'm going to go ahead and pass this on to Andrew.
Okay, so the study I did deals with exercise training for the pathogenic phenotypes for Alzheimer's, which is basically talking about the physical expression of a trait. So in Alzheimer's case, it would be dementia, things like that. Some background information on it. There are very few training regimens that deal with the underlying phenotypes. Most of them focus on treating the symptoms. So you do that, it's not really a long-term solution, you're just dealing with it as it's presented to you. But of the current therapies that are available that deal with those phenotypes, exercise is considered to be one of the best candidates for improvement of them. And one of the major components involved in the study are the amyloid precursor proteins, which I will abbreviate APPs from now on. Some transgenic mice with a mutation of these APPs were used for this study, showing the Alzheimer's phenotypes such as behavioral dysfunction, the amyloid peptide deposition, and neurocell apoptosis, which is the programmed cell death of the neurons. So 10 transgenic mice and 10 non-transgenic mice were assigned to one of the following groups. They were sedentary non-transgenic, exercised non-transgenic, sedentary transgenic, and exercise transgenic. The non-transgenic were established just to set up a control for the overall experiment. And the exercise groups ran for 60 minutes a day, 5 days a week for 16 weeks, while the two sedentary groups obviously wouldn't have exercised. And the Western blot analysis was a method that they used for analyzing the proteins and the presence of the APPs in the brains of the transgenic mice. And previous studies demonstrated that the transgenic mice showed several behavioral deficits accompanied by increased levels of amylase beta proteins, which stem from the APPs. The amylase beta proteins can come together and form complexes that will result in plaques that are toxic to the nerve cells. And these are directly involved in Alzheimer's. The sedentary transgenic mice exhibited higher levels of the AB proteins, and the results of the exercise on this indicated that possibly through regulation of the functions, clearance and low levels of this protein were attained after the exercise training. And through biomechanical analysis, after the final day of exercise, the mice were fasted for 24 hours and whole blood was collected from their abdominal vein. The serum that was obtained was centrifuged, using a centrifuge, and this allowed the experimenters to analyze the total cholesterol and glucose content in the blood. And the results that the exercise had on this indicated that the training positively affects the glucose metabolism, though a similar pattern was seen in both the transgenic and the non-transgenic mice, leading us to assume that the training as far as this goes really applied to overall improvement, not something that deals specifically with Alzheimer's. Looking at apoptotic proteins, using the Western blot analysis, the experimenters were able to analyze the presence of these proteins in the brains of the mice. The exercise was shown to have a significant effect on the expression of these proteins, showing much lower levels than the sedentary mice. And that's just what this picture shows, is the stages that the cell will go through during apoptosis. And the results of the exercise on this suggested that the exercise reduced the prevalence of apoptosis in the neuronal cells by regulating the expression of these apoptotic proteins, which would be good long-term for Alzheimer's, obviously, if you have more better functioning neurons. The Morris water maze was a test used to gauge the memory retention of the mice. They were conducted in a plastic circular pool containing a round platform that was submerged about a centimeter beneath the surface. The escape latencies, which is basically just the time in seconds it took for the mice to find the platform, the escape distances that they swam in that time, and their speeds and patterns were monitored using a camera connected to an overhead, the overhead ceiling. The pre-trained mice were given 5 trials where their ability to find the hidden platform was measured for a maximum of 60 seconds, and they were pre-trained they were allowed to swim around, find the platform in the first place, and then their insertion point was changed in order to gauge their retention of the memory of where the platform was. So we're going to see if they could find it again. And here are the results of that test in these 3 charts. The furthest on the left, you can see the escape distance that they traveled. Not much of a difference between the non-transgenic mice, between the sedentary and the exercise groups, but there is a pretty significant difference in the sedentary and exercise groups of the transgenic mice. you can see that the distance traveled by the sedentary group is roughly around 400 centimeters longer. Escape velocity didn't really play much of a factor into this test, but the escape latency is where we see the largest change. You can see that in the transgenic mice, the sedentary mice took over 50 seconds to find the platform as an average, while the exercise mice took less than half of that, roughly around 26, 27 seconds. And these pictures below show the overhead camera's view, and it shows the path that the mice took to find the platform. Not much of a difference between the non-transgenic mice, but then at the transgenic, you can see that the sedentary mice, it was a lot more sporadic trying to find the table, whereas the exercise mice, they went to where the table previously was, where they remembered it, looked around, couldn't find it, and then they were able to quickly find the new position of the table, showing better cognition, better retention of the memory. So in conclusion, the results of the exercise seem to show that it can serve as a very effective method for the prevention of the AD proteins and neuronal cell death by improving the pathogenic phenotypes of Alzheimer's disease. But further investigation of the exercise conditions are required before we apply these methods to humans, as there hasn't been any human testing, and the physiology between the mice and the humans is obviously going to be very different. And I will pass you on to Brady now.
So my research article was the long-term treadmill exercise and how it improves spatial memory of male APP PS1-DE9 mice by regulation of BDNF expression and microlaser activation. Andrew touched on a little bit of what the APP means, and then the PS1-DE9 is a human precursor protein that is given to the mice before testing. BDNF is brain-derived neurotrophic factors. I'll talk a little bit about those later, and then microlaser activation, I'll talk a little bit about that later on too. The introduction, many AD mice models have been created to facilitate research on AD. I'm referring to Alzheimer's when I say that. However, none of them completely mimic the pathology and pathogenesis of AD in humans. It has been reported that treadmill exercise improved the spatial memory of transgenic mice. The objective of this experiment was to analyze the effect of long-term treadmill exercise on spatial learning and further explore the possible mechanisms involved in the effect. Materials, there were 18 male transgenic mice used. They were split into a sedentary and an exercise group. It also, at the end, says that it used a wild type, but it doesn't specify on how many they used and if it was a part of the 18 original. So when it said it split into two groups, 9 mice were used as a control group. That was a sedentary group. They were still put on the treadmill for the same amount of time as the exercise group, but they weren't exercised. They just sat on the treadmill. The remaining 9 were subjected to exercise on a motor-driven treadmill. Methods, exercise began at the age of 4 months and lasted for 5 months with a 6-day training per week. The mice ran a distance of 70 meters per day at a speed of 5 to 8 meters per minute and gradually increased up to 300 meters at a rate of 10 to 15 meters per minute in 1 month. The speed was about the intensity of 30 to 40% of their VO2 max. Like in Andrew's experiment, they used the Morris water maze as to show the spatial learning of the mice. They also, after the Morris water maze was done, they did immunohistochemical detection after the 5-month treadmill exercise. The Morris water maze, like Andrew has already talked about it a little bit, there's a platform that's about 1 centimeter under the water. There's 4 quadrants within the pool, divided not by anything that keeps the mice from going into them. But the mouse is put into an insertion point. It swims around a long time until it finds the platform, and then that happens for the first day for 5 trials. And there's a flag on the platform to kind of help the mouse get used to where it is, but the platform is moved for each trial. Days 2 through 5, they take the flag out and the platform is stationary, and the mice are allowed to get used to where it is. On day 6, a probe trial is performed where they put the mouse in at an insertion point and there is no platform, and they record how much time is spent in each quadrant of the pool. And now I'll show you a short video kind of giving you a visual representation of how it happens. So in that video, you see the mouse get put into the pool, and he swims around for a long time until he finds a platform, and they take him out. And then the next day they put him back in, and he swims around for a little bit less of a time, and he finds a platform. And then they put him back in, and he pretty much goes directly to the platform, which shows the spatial learning from being exposed to that. In the results, it did improve spatial memory in the AD transgenic mice. We'll show you some figures on the next couple slides. The treadmill exercise did not significantly reduce the beta amyloid plaque that is built up in the brain from having AD. Treadmill exercise increased the BDNF positive cells, and what the purpose of the BDNF cells is it supports the survival of neurons, and it also encourages growth of the synapses and neurons in the brain, which is very positive, especially for someone with Alzheimer's who is having them killed all the time. Treadmill exercise inhibited activated microglia. Microglia are glial cells in the brain that are used to kind of clear clutter. And as you can imagine, with the plaque buildup, those microglias are attacking that buildup in the brain, which is a good thing because it kind of stops the growth of the plaque. But it also increases inflammation in the brain, which is bad because it starts releasing chemicals that kind of cycles into being even worse and starts killing even more cells. This is the first figure that showed the spatial learning of the mice. You can see the wild type is just used as a control. They learned the fastest, but they didn't have Alzheimer's. The Alzheimer's control group, they didn't learn very well, and they were sedentary, so they weren't exposed to exercise. And you can see that with exercise, the Alzheimer's mice learned better and more efficiently than the control group, and that's also demonstrated in this bar graph. This is it shows the amyloid plaque accumulation. You can see that there's not really a difference in the slides of the brain from the mice. There is a slight difference, but nothing that's scientifically significant. This is the figure from the BDNF positive, showing the BDNF positive cells. You can see that there's growth in the cells in the slides a little bit, and you can also tell you have a better idea from this bar graph. The AD exercise is much larger than the control group. In this slide, is the showing that inhibited excessively activated microlasia. You can tell from the bar graph that in the control that it's a lot much higher. It did go down a lot with, or in the hippocampus and the cerebral cortex, and you can see that with the exercise it did reduce that a lot. In conclusion, there is increasing evidence that shows that physical activity exerts a positive effect on cognition function of AD patients. There's a lot of research out there, most of it on animals because you can't really take a human's brain out and dissect it after. So there's a lot of more research is needed in order to apply it to humans. And now I'll pass the conclusion on to Morgan.
In conclusion, Alzheimer's disease, or AD, is a mental decay due to the degeneration of the brain. And we're not sure what causes Alzheimer's, and there's no cure currently, but plaque and tangles are suspects to cell death and tissue loss. And plaques are abnormal clusters of chemically sticky proteins called beta amyloid. And the small ones are more dangerous than the bigger ones because they block cell-to-cell communication. Tangles form inside dying cells, and there's twisted fibers of protein called tau. These tau disintegrate the transport system, which move essential supplies and nutrients through the cells, which eventually die. Most people develop plaques and tangles, but AD individuals form more. And these usually begin in parts of the brain, like the frontal lobe, which help with learning and memory. And we have a healthy brain on the right side, and then the Alzheimer brain on the left, and you see that the difference of the ventricle, the hippocampus, and the overall size of the brain. So in the research study 1, it hit mostly about the frontal lobe, and the frontal lobe controls things such as problem solving, memory, language, and judgment. And you see in this picture how Alzheimer's affects the frontal lobe. So you have loss of motivation, bizarre inappropriate behavior, like say yelling in grocery stores for no reason, walking out of your house, maybe not clothed, things like that, and doing or saying the same things over and over again, such as losing your glasses and they're on your face and asking, "Where are my glasses?" repeatedly over and over again. The first research study tested frontal cognitive function using different tests using executive function, attention, and language. The results, the intervention group had the higher scores than the control group in every activity. And so in conclusion, physical exercise helps with frontal cognition and balance in AD individuals. So the research study 2, they talked about the amyloid precursor proteins, or the APP proteins, and they control the function of certain other proteins by turning off or inhibiting their activity. And in this study, there was mice with and without an APP mutation that were tested, and it showed AD phenotypes. They exercised the rats to analyze the APP presence in the brain. And it also talks about the amyloid beta proteins, which stem from APPs. And these amyloid beta proteins are involved in the ability of neurons to change and adapt over time. And these proteins are directly involved in individuals with Alzheimer's disease. And the sedentary mice exhibited higher levels of the amyloid beta proteins. So this study showed exercise may serve as an effective method of prevention of Alzheimer's. So research study 3 is similar to research study 2. The AD rats were created and tested doing treadmill exercise to analyze the effect of spatial memory. 9 rats were the control group and 9 rats were the exercise on a driven treadmill. And exercise did improve spatial memory but did not significantly reduce amyloid beta plaque. So I have an animated picture of the plaque, and then over here you have an actual slides of what the plaque looks like in the brain. So for the future of Alzheimer's disease, the brain cells fail, but the reason why they fail is not clear. There are currently 5 FDA-approved Alzheimer drugs, but do not treat Alzheimer's disease. They temporarily improve symptoms of memory loss, thinking, and reasoning. And with current research, they're going into how to prevent it and trying to find how to make, people not develop Alzheimer's disease as fast. With aging, connections in your brain may fail due to tangles or plaque,
And staying active, both mentally and physically, can help reduce your chances of having Alzheimer's. So we talked all throughout our presentation about how exercise helps with that. And also brain games, learning new things, getting your brain active will also help with that. So I have an example of a brain game. So you say the color you see, not the word, that is written as fast as you can. And this is a nice example of keeping your brain mentally active and learning and things like that. Okay, thank you.